Hey, good morning, everyone, and welcome to the Lynn Cancer Institute updates, where we're keeping you in the know in 2024. We're very grateful to have you all with us today and to learn from our very own clinical dietitian, Katie Lauterbach. Katie will be educating us today on supplements and functional foods in cancer care. At the Lynn Cancer Institute, we truly believe that nutrition is the basis of healthy living, not only for our patients and survivors, but as prevention and healthy living for all of us. And Katie, thank you for educating us. Your Zoom will be muted during this presentation, and in the interest of time, Katie's bio was sent to you by email. We encourage you to take notes during this presentation, and if you have any questions, please put them in the chat box or the Q&A box, and Katie will have time at the end of the presentation to address any of your questions. So thank you, and Katie, thank you so much for presenting, and here's Katie.
Thank you, Jan, for the introduction as always. Welcome everyone to this talk on dietary supplements and functional foods, especially during cancer care and cancer treatment. As a lot of us might know, cancer care is really a complex, multifaceted task that requires that comprehensive approach. So that's why at Lynn Cancer Institute, not only do we have our medical staff, but we also have psychological and nutritional support. We find that nutrition is not only a foundation for overall health and wellness, but it also plays that pivotal role in improving our treatment outcomes. It can help us manage side effects, and we find that it also enhances quality of life during cancer treatment. So it can be really powerful. And understandably so, patients often want to optimize their health through things like dietary supplements, functional foods, and such during treatment. So, I wanted to share some of the information from a research lens about common foods and supplements that people might look to try to use during treatment or during any cancer care. And we will not cover everything because this is such a broad, expansive topic, but I will try to cover some of the more commonly asked about supplements and some that I've talked about with people recently. So, this, of course, is challenging because this topic really has so much science and safety and efficacy considerations with these products. So, ultimately, anything you want to take during a treatment should be cleared with your medical provider and your dietitian, because even if I'm providing you with some research information here, your situation is very unique to yourself, and you always need to consult with your care team before considering taking anything during treatment. So that's just my little disclaimer before I get into some of the nuts and bolts here. So, what are functional foods? I'm sure most of us know what supplements are, but let's talk about the definitions of each of these so we kind of have a clear understanding of what we're getting into. The supplements or dietary supplements are products taken orally that usually have just one or maybe a few ingredients in them. These are things like our vitamins and minerals. Sometimes you'll see amino acids, you'll see herbs, you'll see other botanicals, and they're intended to supplement the diet. So it's not supposed to replace anything in the diet, but it's really just supposed to add that supplemental aspect. And in cancer care, supplements are often useful for us for addressing things like nutritional deficiencies. It can help us support our immune system and function. It can help us manage treatment side effects and just improve our overall health and well being. However, there should be a very cautious approach with these products because there can be interactions with some treatments or potential toxicities, and a lot of these things could lack the standardization around forms and dosages of supplements. So we just want to approach the topic with caution. So that's supplements. Functional foods are a whole food or a fortified or enriched food source that provides health benefits beyond the basic needs of nutrition. So this is really looking at foods with the lens of looking beyond things like protein, fat, and calories. This is looking at those other components within foods that can really be helpful to us in some way. So looking at like the phytochemical content, probiotic properties, omega-3 properties in foods, all of these things would be considered functional foods because they provide that extra function just beyond basic nutrition. And so these bioactive compounds that we're looking at is what makes them functional. And some other examples that we are even going to talk about today are things like turmeric or curcumin, broccoli. We think about berries. A lot of these things are things that you might eat every day and not even realize it's a functional food. But we'll be discussing those as well and how they can be impacting our cancer care. The specific supplements and functional foods that I am going to discuss today are aloe, lipoic acid, black cohosh, CoQ10, curcumin, dim, flaxseed, and soursop. So we'll go over all those today. And again, not everything that there is to know about supplements and functional foods, but we'll definitely get a little bit below just the surface. So first I want to talk about aloe. Aloe is a cactus-like plant. A lot of us or a lot of people will take it in the form of a gel or a juice, and it also can be used as a topical treatment or a topical moisturizer as well. And these purported uses and benefits are really things like burns, inflammation. Some people say it can help with cancer treatment side effects, and people also say it can help with diabetes. Um, However, we really want to caution with any like supplement form of aloe. So, what the research really shows us is that it can be helpful most from a topical standpoint. So, topical aloe use in studies has been found to potentially delay the radiation dermatitis in patients getting head and neck cancer. So that means that skin irritation, inflammation that you can get with radiation, especially in that head and neck region, which is really cool and something you should definitely ask if this applies to you. Ask your radiation therapist and doctor about and nurses about before just starting it. But the research seems to really support the topical application. And we found in a study that it significantly improved radiation proctitis, which is rectal inflammation, in patients who are using an aloe vera ointment compared to those who didn't use that ointment in a randomized control trial. A randomized control trial is a very high level of research, and so that means that it's very confident that that does actually help. So very good topical uses. We want to refrain from oral supplementations of the aloe, and this is because there can be some reactions like with our thyroid, with liver, and with our liver. So it can cause acute liver inflammation or hepatitis or liver injury. And what some studies see is that the reason being we want to be careful with using it during any treatment orally is that it can actually work and be processed in the similar pathways in the liver that some of these drugs are metabolized through. So cytochrome P450, it might not mean anything to you, but that's just the science term for where it's being processed in the body. And so again, a lot of these drugs will also be processed that way. So we usually don't want to have supplements or foods that are going to be causing any more stress on the liver than what we're already putting it through with treatment. So that would be a reason to avoid it. And then some people found that there was low potassium when taking the aloe vera during chemotherapy. And again, another liver injury with liver enzymes being high. So it's just something that we want to use topically, not orally. Next that I want to talk about is alpha lipoic acid. So I will abbreviate it as ALA and I'll refer to it as ALA just for saving a little bit of time with talking about it. And this compound is a really powerful cellular antioxidant that plays a crucial role in energy production in the body. So while ALA is naturally synthesized in the body, we can also get it from food sources. And it's found to be really rich in foods like red meat, spinach, broccoli, tomatoes, peas, Brussels sprouts, rice bran. Those are just some examples. And ALA does have a lot of health benefits, particularly in the context of chronic disease and also in cancer care. And it's widely recognized for its role with insulin sensitivity or with blood sugar control. And this is particularly helpful for people who might be diagnosed with diabetes or insulin resistance. And it also has been noted to be helpful for people with hypertension or high blood pressure, and it helps with managing that as well. And as we know, people undergoing any cancer care might have these conditions already or might develop them throughout treatment. So it's something to note that even if it's not directly helping with your specific cancer, it could be helping managing some of those other comorbidities with cancer, which is a really important thing to be managing those as well concurrently during any treatment. And for cancer patients, ALA has really been studied in the context of mitigating radiation damage and reducing symptoms of neurotoxicity, which can be a common side effect of chemotherapy. And interestingly, some of these preliminary studies suggest that ALA might even inhibit the growth of certain cancer cells. So, the specific ones that have been looked at in studies include the breast cancer, colon cancer, lung, liver, and pancreatic cancer. However, it's really important to recognize that these are really just preliminary findings, and so we don't have enough conclusive evidence to recommend it to people during treatment at this time. But I found the research that has been done so far pretty compelling and interesting. Just some other things to note we should be cautious about with this supplement is people can have some adverse reactions like low blood sugar. Of course, that's one of the benefits as well. But if you're on any diabetes medication, be careful if you ever start this with that on board because we could get a hypoglycemia or low blood sugar. Some other things would be nausea, vomiting, and then stomach upset. So I thought that this was the interesting research I wanted to share with you. It's really just in the laboratory and animal study findings so far, but still really could be beneficial for us. So first, let's look at ALA's potential to inhibit tumor cells. So studies conducted both in vitro, which means in cell cultures, like in a petri dish, and in vivo, which means in the animal models, or in this case, these mice models, suggests that ALA may slow down or even suppress tumor cell proliferation or growth or expanding. And the graph on the left is illustrating this effect. So it's showing that reduced tumor growth in the group treated with ALA was significantly lower compared to the control group. So that lower line there showing lower tumor volume over time is the ALA group, and the control, which means they didn't get any ALA, you saw the tumor still grew a lot in volume. So I thought that was a very interesting finding, again, in a little petri dish, though. And another benefit to ALL is that ability to reduce the potential oral mucositis. So particularly in head and neck cancers. Now, this study though was done in rats, so we have to take that with caution. We are more complex than rodents, but that's definitely the first step in research is looking at things in petri dishes and in rat studies. So they found that they reduced radiation and induced oral mucositis, which is mouth inflammation. So the rats that were exposed to the ALA or took ALA had fewer episodes of the inflamed mouth than those who did not when they were undergoing radiation. And so you'll see that in the bottom of the screen, on the right side of the screen, the images on the right show that the mock treated or the fake treated, so the control group compared to the ALA group had less inflammation. And so those are imaging just like how we do imaging here to kind of see that metabolically active component of the tumor. We actually see less of it and improved size in the bottom one. So there's a little arrow that's pointing to the dot on the bottom, and that has decreased in size. So again, not necessarily groundbreaking for human studies, but this is where we start, and this is where sometimes we can get a lot of the information from to inform future studies. And so it's something that could be coming down the pipeline as potentially advantageous in humans, but not enough research yet. Black cohosh is one that a lot of patients might come in already taking, and it's a plant that's used in herbal medicine a lot of times for addressing hormonal changes. So the medicinal component of the black cohosh comes from its root. So it's traditionally utilized to manage the hormonal changes and symptoms that are related to like menstrual cycles and menopause, because those are two things that have a lot of hormonal influence with estrogen especially. So what we see here is that this supplement can come in a lot of different forms: tablets, capsules, liquid extracts. That's usually how it's taken. And there can be some adverse reactions depending on dosage or form that you're taking. Some people will get GI upset, rash, dizziness, headaches, nausea, vomiting. So it's just something to note that if you start taking any of those things, to also be on the lookout for any potential side effects. But there can be some pretty cool benefits from this. So the herb is researched with a lot of the breast cancer research, because we are usually looking at the estrogen with that. And one really good thing about it is that they found that bone health seems to do better when we have the black cohosh. So early research is suggesting that the black cohosh might help support bone health by preventing bone loss and encouraging bone formation, which we know is really beneficial for people that are postmenopausal. And this is because a lot of times postmenopausally, we can be more at risk for bone degradation and bone issues. And we also might, if you're going through any treatment that might artificially put you into menopause early, that could be something that we look at as well as bone health. So it's interesting to note that the black cohosh helps with this. And with menopause symptoms reliefs, it seems that people find some relief with this as well. So when people take this supplement alone or combined with other herbs, they seem to have a reduced episodes of hot flashes, although it's not consistent throughout research. So some people find it helpful, some people don't. And then hot flashes that are specifically happening during treatment, it finds that there's some inconsistent results with that as well. It's similar where during breast cancer treatment, if that's the reason why you're experiencing a hot flash, they find that some people do benefit from this herbal and some people don't. So it's definitely something that isn't overall proven in the research, but there seems to be some benefit. Now, the thing to be careful about with this is that there are a lot of herb drug interactions, so we want to be very careful to not negatively affect any of our treatments. So one that is very important to make sure we're not combining is tamoxifen with black cohosh. So some studies find that it can actually reduce the effectiveness of the tamoxifen, which is a drug that's commonly used to treat hormonal sensitive breast cancer. So that's something that we want to look out for. Certain chemotherapy drugs might be interacting with this as well. Some studies found that the black cohosh may increase side effects of chemotherapy drugs. So we also don't want an increased effect either. We want it to do exactly what the doctor is intending it to do. It's also important to note that if you are on any statins, we should be careful of the black cohosh as well, because that can actually, again, have a stronger combined effect with the statin. And so we also don't want our cholesterol to go too low. So there's a lot to look at here with potential benefits and also potential interactions. So just be very careful, because I know this is a very commonly used supplement amongst our patient population. So make sure it's not interacting with anything. Next, I want to talk about coenzyme Q10, CoQ10, another supplement that's very commonly used. And it's a fat soluble compound that's naturally actually produced in every cell of our body. It functions as an antioxidant, and it's very important for energy production in the mitochondria. And body levels of CoQ10 will naturally decline with aging. You'll also find that CoQ10 levels will decrease if you are taking any statins as well. So again, that's another reason why people will start to supplement with it. There's a lot of research going into this right now. A lot of research with mitochondria in general, because it's the energy production zone in the body and our cells. And we are finding a lot of potential benefits of CoQ10. Some of the ones that have been looked at specifically with cancer care are reduced fatigue. So it may improve energy levels for those undergoing chemotherapy. We see a pretty strong cardioprotective effect. So that means with the heart and people undergoing treatment, we know that they can be more susceptible to certain damage to the heart. And so if that's, if that's something that is safe to do during treatment, it might be recommended. And there seems to be this synergistic effect again with the antioxidant compound of or portion of the CoQ10 that seems to help with anything else that might benefit from antioxidants. So there's a lot of potential benefits. Things to look at for adverse reactions or potential interactions would be if you're on warfarin or anticoagulant therapy. And then, of course, it can interfere with some chemotherapy. So we do want to be cautious about using it. The research, I put kind of an outcome that we found success and then an outcome that was found to be not as successful. So like I was saying, CoQ10 may be helpful and protective for the heart. And so especially those undergoing cancer treatment or on certain drugs, they could, have higher risk of harmful effects on the heart. However, it might not actually be helpful at reducing fatigue. So what we see with fatigue and quality of life, a study in breast cancer patients, the top one, 236 breast cancer patients were randomized to receive either the CoQ10 or the placebo. And the study found that the levels of fatigue and quality of life were not improved in patients who were taking the CoQ10 compared to those who received the placebo. So unfortunately, we found in this study that the results did not significantly improve. It's challenging because even if there is a slight improvement that we find in studies, if it's not statistically significant, we say that it doesn't, that it's not strong enough to prove for us to recommend it. However, that might not be there is always anecdotal experiences. So some people might still find it helpful, but in this study, this randomized study, they found that there wasn't a significant difference. With the cardiovascular protection, this study was actually done in children, but it still can be, we always extrapolate and apply studies to other populations as well. So with children, they found it was specifically helpful to use CoQ10 for cardiovascular protection. So it could be the case in adults as well. And so that might be something that is interesting to look at, especially if someone comes in with a comorbidity that is also, a cardiovascular comorbidity. It could be something to consider and talk to your doctor about if it makes sense to either stay on or start a CoQ10 supplement with your treatment. curcumin, which is also known as, it comes from turmeric, and the curcumin is the active part, or the antioxidant or polyphenol part that's found in the turmeric plant. Turmeric is found naturally in India and tropical regions of Asia, but we can find it in our supermarkets here as well, and we can find it also in supplement forms. People take it both ways. They will use it to season their food, or they'll take it in a supplement form, or sometimes even a tea form. There's a lot of potential benefits to curcumin and turmeric. So anti-inflammatory is like the hallmark known one, and it actually inhibits the same enzyme that ibuprofen will. So sometimes I think about it as kind of like an ibuprofen, where it's really powerful at reducing inflammation that way as well. But of course, there's other there's the dosing to consider. There's the a lot of the source that you're getting it from. There's a lot of things to consider, but I think it's interesting that it plays on the same pathways as ibuprofen, and so that's how it helps reduce inflammation. It's an antioxidant. It also can have some anti-cancer properties. So again, things to note in terms of adverse reactions or interactions. If you're on any blood thinners, you have to be careful with the turmeric because it is a natural blood thinner. So a lot of times, even if you go for like a surgery, people will tell you to stop taking any blood thinners. You got to make sure you also stop your turmeric and your fish oils as well. And turmeric it's a double-edged sword. Sometimes it helps with chemotherapy, and sometimes it can lessen the effects of chemotherapy. So it really depends on what your chemotherapy is, and we need to consider all those things. So another thing with the curcumin supplements is that it could increase side effects of a specific immunosuppressant drug. So again, cross-referencing, making sure that it's okay to take with whatever medications you're prescribed. The absorption is very interesting for the curcumin. I think it's very important to note that the solubility and bioavailability, which means the ability to basically get it in our cells, is extremely poor in its natural form. So less than 1% of any orally ingested curcumin is going to be absorbed into the bloodstream. So that means we have to do a lot of things to increase the absorption. Ways that we can increase the absorption naturally is with black pepper or black pepper extract. And this increases curcumin absorption up to 2,000%. And it's because it inhibits the liver enzyme that will break it down. So whenever you cook with turmeric, always put black pepper with it. A lot of products are good now at already having the black pepper extract with the curcumin or with the turmeric, but just make sure that's there as well. Any supplements as well, make sure it has a black pepper extract in it, because otherwise you're not going to be able to absorb it well unless there's some type of like liposomal or micelle component to help it absorb, which is the next point, that fat encapsulation of curcumin in lipids or fats can help make it more bioavailable as well. There's also, you'll see in some supplements, they might refer to the curcumin phospholipid or curcumin fat component as Merivin or Meriva, and that is just another like name for the more absorbable form. So you can notice that verbiage in a supplement as well to know that it's a good absorbed supplement. So yeah, that's just something to note for the absorption. Looking at the benefits of curcumin and what some of the studies find, we find that with breast cancer treatment, there are some pretty good outcomes here. So we see that that curcumin can slow cancer cell growth. So curcumin can slow down the growth of breast cancer cells by blocking a key pathway, which helps the cancer cells to multiply. So it's stopping the multiplication of the cancer cell growth, which is pretty impressive. You'll see in the image here that I put on the screen that's from the study that's listed below that it's actually inhibiting that certain part of the pathway the same way that some of these anti-cancer drugs like cisplatin are inhibiting the pathway. So really, really interesting. It can also make chemotherapy more effective. So some breast cancer cells become resistant to certain types of chemotherapy, making it less effective. But what studies find is that this liposomal curcumin, the one that absorbs better in the body, can help reduce this resistance, allowing the medication to work more effectively. So curcumin can be helpful in this setting. Another thing that we see is with protecting bone marrow during treatment. So, especially when patients are on a carboplatin or cisplatin, we find that in mouse studies, which is why I have the little picture of the mouse there, we find that curcumin improves the myelosuppression induced by carboplatin, which is just a fancy way of saying that the curcumin helps the ability for the bone marrow to still produce good, the white blood cells and red blood cells. So it's helpful for that. Another thing that we find is that it can make the chemotherapy work better, kind of like mentioned in the last slide. So curcumin can sensitize cisplatin resistant tumor cells, so it can make the tumor cells, it can make the cisplatin work better on the tumor cells. And there's also some component that shows that can also reduce the cisplatin-induced neurotoxicity. Sometimes people get the neuropathy in their fingers and their feet. It can actually help with reducing that. So again, super interesting, lots of research on this. And I put up on the slide, I realized I didn't mention this, the imaging that I have here listed on the slide is talking about the bone marrow, protecting the bone marrow during treatment. So you'll see the platelet counts for the combination of the treatment with curcumin are higher than just with carboplatin alone. And so it can actually help with platelet levels and white blood cell counts. And that's just what that imaging is showing. Another supplement that people will ask about a lot is DIM. This is something, again, along the lines of like the estrogen supplements, or supplements to help with managing estrogen levels in the body. So DIM is actually a naturally occurring plant compound. It's found in things like cruciferous vegetables, which are vegetables like broccoli, cabbage, cauliflower, and laboratory studies are suggesting that it has an anti-inflammatory effect and anti-cancer effect. But we're really limiting the data in these human studies. It's really more of the lab studies that we're seeing. Some potential benefits could be with prostate cancers or with breast cancers. But again, the information, we still need more information before we would recommend something. And it's also really important to note there is an important drug interaction here with tamoxifen. So DIM may interact with the hormone therapy due to the potential anti-estrogen effects that it naturally has. So it's just something to note that you may want, if you're on that medication, you would want to clear it with your doctor first. Another thing to note is that, again, you're getting it from the cruciferous vegetables. So with a lot of these supplements, when they're tested in the labs, they're usually tested in the kind of dosage or potency that a supplement would be. But remember, these things are also naturally occurring in foods. So if we're ever scared of taking something because of an interaction found in a study, so for instance, like tamoxifen with DIM, just know that we can also still get it from the natural food source, like broccoli, cabbage, and cauliflower. So if there's ever something that you still want to get some of the benefits of, but you don't want the risk of taking the supplement, you can always take the food source. Okay. Another thing that this is more of this is one of the functional foods, the flax seeds. Flax seeds come from a flax plant, and it's really high in omega-3 fatty acids and fiber. And the flax seed is a source of actually plant-based estrogens, so phytoestrogens, which we know are really helpful at reducing our own body's ability to manage the estrogen. So it can be helpful with things like some mild menopausal symptoms and hot flashes and stuff like that. And flaxseed can be used in a lot of different ways. We can use it in foods like crackers, waffles, oatmeal. We can mix it into protein shakes or yogurt. It is best to have it ground instead of a whole, because you're going to absorb more of it. So just note that when you have the whole flaxseed like that, you either want to grind it yourself to get the powdered form or buy the powdered form. The reason why someone might buy the whole form instead of the powdered form is because omega-3s can become like rancid or not good after a certain amount of time. And so it's recommended to keep like the flaxseed powder or ground flaxseed in the fridge to help reduce it from going bad. And you could also consider grinding your own flaxseed fresh to make sure that it doesn't go bad for you. Other potential benefits: stabilizing blood sugar, lowering cholesterol, treating constipation. So all of those are things that could be beneficial from this functional food. Especially with our breast cancer, we find a lot of benefits with the flax seeds. So we find, because it can help with gut health, the eating the flaxseed or putting it into your foods more can help with improving your gut microbiome, or the bugs and bacteria that are good for you that live in your gut. And a healthy gut can actually influence that breast tissue development, and it may actually lower risk of breast cancer. So really cool how the gut is then helping reduce risk of breast cancer. Also, it can help with slowing cell growth and also destroying cancer cells. So in animal studies, we see that flaxseed slowed growth of and spread of cancer cells by lowering hormones like insulin-like growth factor and blocking cancer-promoting receptors such as epidermal growth factor receptors. So whenever we're reducing the ability for a cancer to grow and spread, that is obviously going to be very helpful in our overall goals here. And this kind of functional food can help naturally do that. And then it can also help with we even find that it helps destroying cancer cells. So flax seeds, in a specific lab study, showed that it helped kill cancer cells by activating a p53 gene, which acts like a cancer fighting switch in cells, telling the cells that they have to die. So really powerful and interesting. You can start incorporating the flaxseed by just mixing 1 to 2 tablespoons into your foods, and you can gradually increase over time as desired. And if you ever have issues with figuring out how to incorporate it into your daily routine, you can ask one of the dietitians, or you can even Google online how people incorporate flax seeds, because there's a lot of good resources out there. Soursop is another one I want to discuss. I get asked about it quite often. It is a dark green prickly fruit that comes from a tree, and it's the graviola tree. Usually people just refer to it as soursop. This tree is actually from rainforests in Africa, South Africa, and Southeast Asia. Although I have seen it grown here now, and the fruit itself has a lot of nutritional benefits when consumed as food. The leaves and stems are more so used in like traditional medicine for symptoms associated with like inflammation, infection, and in some Caribbean countries, it's very popular to use this herbal remedy for certain types of cancers. However, we don't actually have any concrete data showing or proving that it can help actually treat cancer alone. But some people might use it in addition to any treatment. There are some things to be careful of, though. So be cautious on interactions with blood pressure and blood sugar, especially if you have any of those current issues. And then you really want to avoid soursop if you're having any imaging done, such as a PET scan, because it can impact your results, and we want to have very good data on those scans, and we don't want that to influence anything, or mask anything. The benefits of soursop that we do see some in breast cancer, pancreatic cancer, colon and lung cancer. So what we know is that we can use its extracts in several different ways. A study with breast cancer found that soursop might stop the drug-resistant breast cancer cells from growing by cutting off their energy supply. When looked at with pancreatic cancer, it was found that it can block cancer cells from using sugar as energy, which they need a fuel source to grow and spread. So if you block off the energy source, you really block off the ability to grow. In colon and lung cancer, we found that soursop can trigger cancer cells to die by disrupting proteins that help keep them alive. So that's a lot of kind of preliminary information on how this might actually help us. But it's also important to know that these are a lot of like lab and rodent studies, and we don't really have the human grade studies to prove this yet. And we also want to make sure that, again, it's not interacting with any treatments. So it's something that you can maybe include with with a treatment, but it shouldn't replace any treatment. And what should you stop any supplements during treatment? All the time I hear people say like, "Oh, I just stopped everything because I didn't want it to interact with treatment." And while we want you to stop certain high dose antioxidants like vitamin C and zinc, we don't want you to just stop everything. A lot of times, a general multivitamin is fine to take and can even help with filling in some of the gaps in your diet in the meantime when you do maybe have a lower intake. And there can be some other supplements that I didn't discuss today that are certain vitamins that could be very beneficial during treatment, like vitamin B or a B complex can be very helpful during treatment. If it does not interact with your treatment, there's certain ones that it will interact with, and it can help, especially if you're on any antacid medications, because the antacid medications reduce our ability to absorb certain B vitamins. So that's really important to make sure that we correct any deficiencies if they're caused by medications. Another thing that we need to make sure we're doing is a vitamin D supplement. So that one is one that I've never seen or read about an interaction between vitamin D as in dog and any type of treatment. So I always am pushing that on people. The dosage gets tricky because there's a lot of different levels of dosage, and we want to check and see what our current vitamin D level is. So I always tell people check with your provider what your vitamin D level is before we just start supplementing. And if you have any questions about a supplement, that's why the dietitian team or nutrition team is here, is to help clarify or answer any of those questions. Always run it by the physician that's treating you and your dietitian to make sure that it's okay to be taken with treatment, and also that it's the right dose and right type. So that's what I want to kind of run home as the overall message. I also wanted to just share this really cool database because we only just touched the surface of information here. So I did want to share this database, which is about herbs, botanicals, and other products. You can actually search the herb that you're in, or the whatever botanical that you're interested in and learning about. And this Memorial Sloan Kettering Cancer Center database does go over any interactions with treatments, and it goes over potential uses of these things. So it's a really nice evidence-based resource that we could refer to. And all that being said, I want to make sure we still have a little bit of time for questions. So I did just want to promote our next cooking demo is on the 17th at 11:15 a.m. Brandy is going to be talking about plant-based holiday slides. She's telling me about some of the options today, and they sound delicious. And then Marie is going to be doing our nutrition lecture for nutrition for longevity, and that'll be January 15th. So with all that being said, would love to answer any questions if people have them. If anyone has any, let me see if I can find the chat box here.
Yeah, I don't see anything in the chat box or the Q&A. A comment.
Thanks, Melissa.
Yeah, I don't know. I think, Katie, that for me, this education was, I mean, it's almost like you want to go back over all the slides because
Yeah.
I feel like I was just at a university lecture. It was like, I want credits for this. You did so much research, and the way that it was presented was truly just so amazing and so informational. And again, for myself, there were so many of these supplements that I've never heard of. So it really is just really interesting to see how we really can, add to our health by these supplements and the food that we eat. Yes, Elsa said excellent. It was an excellent presentation. And I think for everyone that's on here, I think that everyone knows that our lectures are recorded. And I think this is definitely one that any of our clinical providers would want to have on hand to share with their patients because there's so much good information here. And also to be able to share the whole presentation with patients, family, or friends, because as with all of our nutrition lectures, yes, they're cancer focused on our cancer patients, but I think it's education that's really worthy for all of us. So thank you, Katie. And I know there was a lot of work that went into this, so we really appreciate that.
Course.
And we appreciate everyone that joined us today. And our next presentation for December will be from our survivorship series. And the topic will be moving forward after cancer treatment, important guidelines for quality of life. And this will be presented by one of our physical therapists from the Drummond Therapy Centers. Her name is Ruth Light. So as I said, these lectures are geared for cancer patients, but really pretty beneficial for all of us. So thank you, Katie. Thank you for everyone that joined us today, and have a good afternoon and happy holidays, everyone. Bye.